I got a call from the state Department of Health Services. When I first started hearing about the coronavirus and COVID-19, we were learning that there are hospitals that are overwhelmed right next to hospitals that are waiting on patients. We got to figure out how we're going to fix this. We needed CentralLogic's help. I called Barry, and Barry said, yep, done.
I go to Matt and say, hey, Matt, I need to deliver this.
We're already built to do this.
And ultimately, the goal was to establish a platform and a system that would allow the state to identify all the resources across the state where both hospitals as well as providers and equipment, so that they could track those assets and resources and effectively manage the flow of COVID across the state.
So the triage is able to get that information and deploy that information to every area where it needs to be, so that the patient can just get to right where they need to be as quickly as possible.
It has bed visibility ready like it's never been before. It has the infrastructure of load leveling patients ready like it's never been before.
This was the biggest, fastest implementation that we've done. And we had to do the whole thing remotely.
But CentralLogic just kind of flipped the switch and got it done, and it was really inspiring to watch.
That would have been impossible without Azure.
With our solution being in the cloud now, the ability to manipulate and reconfigure the system with minimal downtime, if any, is just tremendous.
Nobody does cloud computing and having this, nobody does this better than Azure.
It allowed us to be much more nimble with the platform than we were previously.
You know, there are a number of other things that have to be in place, especially in healthcare, like the Azure Security Center. Really what that boils down to is making sure only the appropriate people can access that patient-specific information.
We're able to pull information out of it and report on it, but protects the health information of the patients.
Really what the search line boils down to is access. Whether you need to access transport, you need to access healthcare, you need to access advice, you need to access medication. It's really the front door for all of that.
In order for the business of healthcare to succeed, access to care has to be at the forefront.
And that's the thing, we did not build a COVID-19 solution. You know, we built a solution that is able to adapt to surges and get patients to where they need to be.
I think it's groundbreaking. I think it's a model for other states or maybe even at a national level.
In a situation like this, a global pandemic, moments matter.
And it's not because of what we did as a company, it's what we're doing clinically to take care of a population of people.